Regaining knee stability is one of the most important things that you can do when recovering from an ACL surgery. Because while strength definitely matters, it's meaningless without good knee control. You need to position your knee optimally to make the strength count, helping not only to prevent re-injury, but also to allow you to maximize your quickness and power. So to help you along your rehab journey, and to help spice up your stability exercises, I'll be sharing 4 of my favorite stability exercises, each offering their own unique benefits to enhancing knee stability. Incorporating rotational stability exercises into your rehab routine is key since we frequently move in a rotational manner in daily life. This is especially important in sports, where rotational stability is essential not only for power production, but also preventing recurrent knee injuries. Avoid the trap of performing stability or strength exercises in just one plane of motion, as this has limited carryover to real-life activities and sports. This exercise specifically targets and enhances rotational stability, making it an invaluable addition to your routine. To create stability demands at the knee, you need to introduce instability. For this exercise, you'll generate instability through your upper body movements. Stand on one leg and perform a slow, chopping motion towards your foot. I'm using a medicine ball to increase the challenge. But if that's too difficult, you can perform the exercise without any weight and focus on the quality of movement. Avoid sloppy movements. Quality over quantity is key. Move slowly and only go as deep as you can control. I recommend performing high repetitions to reinforce stability and build endurance. Typically around 2 to 3 sets of 15 to 20 repetitions for all of these exercises. For the next exercise, we'll be adding an unstable surface by using a Bosu ball. If you don't have a Bosu ball, a foam pad will work just as well. Unlike the previous exercise, where the stability demands were from top down and more anticipatory, in other words, you generally knew the direction and amount of the stability demand, this exercise is the opposite. It focuses on reactionary stability, requiring you to respond to unpredictable movements of the Bosu ball, and finally grade your muscular control. This emphasizes your muscle's ability to stabilize the knee effectively. The stability demands come from the bottom up, making this exercise more dynamic and unpredictable. Only reach as far as you can control. The deeper you go into the single leg squat, the more challenging it becomes. If you find yourself constantly losing balance, or if your knee is shaking excessively, pull back a bit. Move slowly and emphasize quality over quantity. Focus on controlled, precise movements to ensure stability and effectiveness. This next exercise is where it really starts getting challenging. Like the previous exercise, this is a reactionary balance challenge from the bottom up, but now with the added complexity of managing a landing. This exercise is quite demanding and will significantly test your stability of your knee. Start with small alternating jumps and progress to higher jumps as your control improves. Really challenge your balance by trying to stick the landing with minimal movement from your ankle all the way up to your leg. Take it slow, and once your foot hits the ground, hold the position for 2 to 3 seconds before switching to the other leg. Also, make sure to avoid locking out the leg when you land. Keep your knees slightly flexed to ensure you control this movement with your muscles. This will thoroughly test your ability to attain and maintain knee stability. Now, all this time we have focused on maintaining knee stability using primarily visual and proprioceptive feedback from the joint. Proprioception is your body's ability to sense its position and movement in space, which is crucial for balance and coordination. However, there are multiple balance systems that you need to be trained for comprehensive stability. Another critical balance system to train after recovering from an injury is the vestibular system. This system, located in the inner ear, plays a key role in helping us balance and maintain stability, especially during dynamic movements. By incorporating exercises that challenge the vestibular system, we can enhance overall stability and improve our ability to react to various balance demands. Combining proprioceptive, visual, and vestibular training ensures a well-rounded approach to balance and stability, crucial for preventing re-injury and improving overall performance. Now, this exercise may not look challenging, but it is. At least it was for me. For this exercise, stand on one leg with your hand in front and focus on the tip of your index finger. To really challenge the vestibular system, turn your head quickly at a pace of roughly 120 beats per minute. You can find a metronome online to help keep this pace. The key is to keep your eyes fixed on your fingertip during head movements, without losing sight of it. This will push your balance and coordination to another level. This exercise specifically trains the vestibulo-ocular reflex, or VOR, an involuntary reflex that stabilizes your vision while you move your head. When you move your head, your eye muscles immediately respond by creating an eye movement in the opposite direction of the head movement, at the same speed. This helps to stabilize the target image on the retinas of your eyes during head movements, which is crucial for activities that require focus during high-speed movements, such as in sports. For an added challenge, try standing on an unstable surface, such as a foam pad or a Bosu ball. However, make sure your stability is good enough before making this already challenging exercise even harder. This exercise will significantly enhance your stability and coordination by targeting the vestibular-ocular reflex. These high-level stability exercises are typically utilized in later stages of ACL rehab, once sufficient knee range of motion, strength, and basic balance have been restored, usually around 10 to 12 weeks after surgery. Therefore, if you're currently in rehab, it's essential to consult your therapist before attempting these exercises. And don't forget to support the channel by giving this video a like if you found it helpful. Your support goes a long way in helping our channel grow and help more people like you. Also, make sure to subscribe to the channel to stay up to date on everything you need to know about your body, how it works, and what it needs to keep moving.